My name's Ian. I'm a pediatric nurse practitioner at Sunshine Emergency Department. I've been a nurse practitioner for 12 years, but I've been a nurse for about 21 years, and prior to that I was a paramedic. My role allows me to look after children, mainly children that come in with injuries. They're in pain, their parents are anxious, and to be able to relieve their pain and help the parents' anxiety and be able to send them home with a positive experience of hospital rather than a fear-ridden one is really satisfying for me. Glove protection is really important in my job, not only to protect me but to protect my patients. I deal with a lot of children with wounds, cuts, burns and things like that, so I need to glove up to prevent infection. I developed a glove allergy probably about 4 years ago now. It took a while to diagnose me and find out exactly what I was allergic to, because unlike type 1 allergies which come out almost immediately, the type 4 allergies can be delayed, and they didn't automatically come up when I put a glove on, then I would react to it. It might be days later before I would get some sort of reaction. And eventually continued use of the gloves meant that my hands continued to swell. I went up almost 2 sizes in gloves because of the swelling. The skin was extremely dry, around the knuckles and all the joints, the skin would crack and break open, so I had continually bleeding hands and cracked skin. Any movement of the hands was painful, and the itch was incredible. A lot of times I put the gloves on before I went to see the patient to avoid them seeing my hands. I tended to avoid patients that required wound care, or I would maybe do a visual examination of the patient without contact and get a colleague to do the dressings and other patient contact. So it affected me in that way. I went to a dermatologist after about a year of trying different gloves, different hand washes, all sorts of different things, and nothing seemed to help. I went to a dermatologist who basically said, oh, it's just eczema, it's nothing to do with contact. He'll have some steroid creams and go away. I also had an issue with sterile gloves. It wasn't just the examination gloves. The sterile gloves also affected my hands, which meant that even simple sterile procedures like suturing I couldn't do. My hands eventually got so bad at work with the cracked skin that I got an infection to my little finger that was really painful and really sore. I showed it to one of the plastic surgeons at work, who basically decided that I needed to go to theatre immediately and have this incised and drained. They did that in theatre. I was admitted to the hospital for 3 days and then signed off straight away for 3 weeks. It was frustrating having that time off work because, to all intents and purposes, I felt I was still fit to work. Because of the infection that I got in my fingers and having surgery, I was sent to the Skin and Cancer Foundation for allergy testing. At that foundation, they put 120 skin patches on my back. When I came back for the results, they removed the patches and found I had extreme reaction to chemical accelerants used in the manufacture of gloves. I would just say to colleagues to be aware of what contact allergy looks like, and that just because we've moved on from latex doesn't mean to say you can't get allergy to gloves or other rubber products. I use Ansell chemical accelerator-free gloves. Since using those, I've had no issues with my hands at all. Now I feel I can get on with my life, get back to normal, do my job as I'm trained to do.